My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Today on the Expect Miracles podcast, we have Dr. Richard Jacoby. Dr. Jacoby is a regenerative medicine specialist out of Scottsdale, Arizona. Dr. Richard Jacoby has treated thousands of patients with peripheral neuropathy. He shares his insights as well as the story of how he connected the dots to determine how sugar is the common denominator of many chronic diseases. In his book, Sugar Crush, he offers a unique holistic approach to understanding the exact toll sugar and carbs takes on the body. Based on his clinical work, he breaks down his highly effective methods, showing how dietary changes, reducing sugar and wheat, coinciding with an increase of good fats, can dramatically help regenerate nerves and rehabilitate them to their normal function. Today on the Expect Miracles podcast, Dr. Jacoby discusses what sugar is really doing to the body, what diabetes, Alzheimer's, carpal tunnel syndrome, and autism have in common, and what you need to know about regenerative medicine and stem cells. Please welcome Dr. Richard Jacoby. Today on the Expect Miracles podcast, we have Dr. Richard Jacoby out of Scottsdale, Arizona. Dr. Jacoby is a regenerative medicine doctor. He's done some amazing work. He's written a book. The book's called Sugar Crush, Doc?
That's correct.
Perfect. And today we are just going to be speaking on what is sugar really doing to the body? What do diabetes, Alzheimer's, carpal tunnel syndrome, and autism have in common? And everything you need to know about regenerative medicine and stem cells, because that's been really growing over the past 5-10 years, right?
Yes, absolutely.
Great. So, Doc, before we jump into that, where are you from originally?
Ocean City, New Jersey.
Beautiful. God's country.
Yes, it is.
All right. And how did you get into the regenerative medicine field?
Well, I've been practicing for quite some time. My background is started in Philadelphia, the Pennsylvania Hospital, where I did my training at Pennsylvania College of Podiatric Medicine. So I did traditional medicine, allopathic medicine for many years. I also did additional training with Dr. Lee Dellon, who's a peripheral nerve surgeon at Johns Hopkins. And he trained me in peripheral nerve surgery about 20 years ago. And I made the mistake of saying to him, I think there's more to your theory than you had originally postulated. He said, he's a professor in neurosurgery at Johns Hopkins, and that was the wrong thing to say.
Oh, yeah. How did he take that one?
He didn't take it well. He said, why don't you figure it out? So I said, well, let me read outside of my expertise. And I started to read journals I never thought existed. And I found a journal, the first one I hit was the circulation of the journal Circulation, and Dr. John Cook wrote an article, very complicated article called The Uber Marker. And John is a cardiologist by training, a PhD in vascular biology. He was at Stanford. So this started my quest, shall we say, into understanding what the biology and the biochemistry behind nerves was. And I think he was correct. So I texted him, not knowing him per se, I knew his name, just reached out to him, and I said, Dellon's got a theory down at Johns Hopkins. I think your theory of the Uber marker has something to do with that. He called me an hour after I texted him on the phone.
Really?
Yes, which was amazing. Full professor at Stanford reaches out to me to answer this question. He said, your ideas are interesting. Why don't you come up to Stanford, which I did back in 2005. And we started to look at his molecule, asymmetric dimethylarginine. So we'll call that ADMA. That basically is a molecule that causes the nitric oxide pathway to be disturbed. And that's a new concept.
And what's so important about that pathway?
Well, I believed it was the Uber marker, the blood supply to the nerve, which is the vasovasorum and the vasoneurorum. So he said, well, come up and we'll look at it. So we tested a bunch of patients, my patients, with his molecule, about 160 patients, and I found a cluster of patients up in the fifth quintile that had other neuropathies, such as MS. And that was the predominant one. So I was at an MS meeting with him in 2010, 2009, and I showed him my data, and he said, why don't you come up here and work with me? And I said, well, I'm a clinician.
Right.
I would rather just write a book, let the real scientists figure this out. And that's what I did. And that's the book, Sugar Crush. So I went back to Dr. Dell and I said, look at this data. And he was really not excited that I talked about the biochemistry of nerves because he's written 2 textbooks, maybe 700 articles, 55 chapters in medical textbooks. And his theory is pretty amazing, and I'm messing with it. But we became pretty good friends, and we're still friends to this day. He wrote the introduction to my book, but he was not thrilled about it in the beginning.
But so you obviously had some valuable information that really shook things up and changed everything.
I think so.
Yeah.
So I wrote the book. It came out in the year 2015, and I think we have the connection biochemistry-wise of nerves. And bottom line, what I'm saying is that diabetic polyneuropathy, autism, Alzheimer's, MS, and every other neurodegenerative disease are really the same disease with different names attached to them. Just different nerves, same biochemistry. Now, it's pretty controversial.
Yes. Yeah, definitely.
So Dellon did not have a level 1 study done at that time. So most of the neurologists said this is nonsense. His procedure, which, and we'll go into that in a second, his procedure is decompression of multiple nerves in the lower extremity. That's the procedures I was doing. But we didn't have a level 1 study. Now we do. So a fellow by the name of Shai Rosen out of Israel, who was at the University of Texas, set out to disprove Dellon's theory. And that was about 10 years ago. 7-year study, cost over $1 million, did a sham study. And what that means is double blind, you're handed an envelope, you're in surgery, you're going to operate the left leg and just make an incision on the right leg. Compare that data to the standard of diabetic neuropathy against the sham. Long story short, over 7 years, Dr. Dellon's procedure is about 76% more effective than the traditional treatment for diabetic neuropathy and the sham. His procedure is proven correct.
This is the doctor that tried to prove him wrong out of Israel?
Yes.
Okay.
And now he's proving it right. He's a plastic surgeon by training, and he runs the animation surgical department at the University of Texas. And I said, animation surgeon? I thought he worked for Disney. His expertise is strokes. And so when somebody has an asymmetric face, he can reroute the nerves and make that symmetric.
Wow.
The other subspecialty is Bell's palsy.
Mm-hmm.
So I met him at one of our nerve meetings, and I said, I presented my findings, and he liked the findings. And he said, I like your theories, except not for Bell's palsy. And I said, why is that? Well, I think because he never thought of it. Well, it works for Bell's palsy as well. Sugar is the common denominator. On which sugar? In my opinion, it's high fructose corn syrup. The way it's made, genetically modified, the way it's processed, there's mercury used in it. It's very neurotoxic.
They put mercury in that, huh?
Oh, yeah. Yeah. Which is amazing. That was something I found when I was writing my book.
And it's pretty much on every shelf at the grocery store, definitely. Well, not every, like in a lot of aisles at the grocery store.
Well, 80% of all the food in the United States has high fructose corn syrup in it. 80%.
80%.
And the other types of food, such as dairy and milk and meat, also have it in it. So let's explore that for a second, because that was shocking to me.
Mm-hmm.
So if 80% of the fast food, comfort food has it in it, and I think we all know that now,
Right.
the quote-unquote non-organic food has it as well. So let's go back and look at cattle. So you're feeding them corn, genetically modified corn. 98% of all the meat in the United States has that in it. And it's also genetically modified. And it has glyphosate, which is the active ingredient in Monsanto's herbicide Roundup.
Mm-hmm.
Now we have another process. We have genetically modified. We have organically changed that process with glyphosate. And glyphosate really is glycine, the amino acid, with phosphate.
And that just tears up the intestinal tract too, right?
Absolutely. So there's a gal from MIT who I discussed when I was writing my book, and her name is Stephanie Seneff, and she is the one who exposed glyphosate, and she introduced me to the concept of the shikimate pathway, and that's the pathway biochemistry of plants and in our gut. So we're eating this stuff. It gets through the leaky gut syndrome, which is still controversial, but is true. Those proteins are interrupted, goes through the blood-brain barrier, and it gets out to all our nerves. So let's swing back to the 1860s, which I found this kind of amazing. Most of these diseases were discussed in the 1860s. Their prevalence was very, very small.
Mm-hmm.
MS is a perfect example. Charcot, France, 1860s. He named the vagus nerve that is what we know is multiple sclerosis, and that's Latin for multiple areas of white spots in your brain.
Mm-hmm.
That's not a diagnosis, that's a description of a process.
Yeah.
But given that it was the 1860s, we're now learning these things. And interestingly enough, in the foot, Morton's neuroma, 1860s. So most of these diseases were named then. Autism was not. Carpal tunnel was not. These are modern day diseases. So coming forward to 1974, that's when high fructose corn syrup was introduced into our diet. That was the same year that the desktop computer was introduced as well. So carpal tunnel. Prior to 1974, in the literature, there were 12 cases of carpal tunnel.
No way.
12 cases.
Wow.
Last year, there were over 500,000 surgical procedures in the United States on carpal tunnel. The answer is sugar.
Sugar.
Sugar. So I started to look at all these abnormalities from a biochemical standpoint. Gallbladder disease, that's sugar. There were over 800,000 cases last year. Gallbladder is sugar, and that's a branch of the vagus nerve going down to the gallbladder. Gallbladder is a muscle, and the muscle is innervated by that nerve. If the sugar is affecting that nerve, that gallbladder, which is a muscle, doesn't empty. You form a stone, block that in the intestinal tract. It's painful. You cut it out. 800,000 last year. So these all have a common denominator.
Doc, I'm just curious, what is actually happening to the nerve with the high fructose corn syrup? Oh, I know it causes inflammation and everything, but what is it actually doing to the nerve that is causing all this damage?
Okay, great question. And that's the first question that I asked Dr. Dallin back in 2000. And there were two answers at that time. Number one is the Maillard reaction. It's a biochemical process, advanced glycosylated end products, where sugar and a protein come together in a biochemical fashion, goes through a couple processes, shift base, but bottom line is it shortens the mechanical distance in those molecules. It causes compression of the soft tissue. That's carpal tunnel. I don't know if you can see that on the film here. So you have a ligament over top of the median nerve. That nerve is becoming shortened. That compresses. At the same time, the second biochemical reaction is the polyol pathway. Polyol pathway really means sugar is being broken down to sorbitol by an enzyme. And that sorbitol, which is an alcohol sugar, pulls water inside the nerve, and that causes swelling. So if we have a physical compression with a nerve that's swelling, we cut off the blood supply to that nerve and to whatever the end organ is. The nitric oxide pathway, which they just got the Nobel Prize in 1997, I'm reading this stuff in the year 2000. Dallin wrote most of his papers prior to that, so he did not have that in his research. Dr. Cook at Stanford did. That's why I reached out to him. So asymmetric dimethylarginine blocks that nitric oxide pathway and the blood supply to the nerves. So that's the third pathway.
This is all very interesting. I finally realize where you're going with the regenerative medicine now.
Yes.
Okay. I know we'll get there. But,
Okay. So what
okay.
is the traditional medicine? And let's talk about chiropractic, because chiropractic talks about these nerves as a mechanical disruption for the most part. But you also talk about it from a chemical reaction. So lesions, which I think is the term you guys use, is a different nomenclature that Dr. Dellon would call it.
Right.
He calls it nerve compression. Well, aren't we talking about the same thing?
Exactly. Different terminology.
Exactly. It's a perfect segue into how we treat. Early phase, you mechanically decompress the nerve wherever it may be. And I know in the past there was a lot of controversy about making claims that gallbladder disease, other somatic complaints. Well, it's true. It's true. But it's hard to prove. So most of chiropractic work is around pain. And most of the work around allopathic is also around pain. So now we have a common denominator. Different language, perhaps, but now we have multiple different disciplines looking at the same problem from a different point of view. The biochemistry is the same, and that's where we get into regenerative medicine. Now, I'm a traditionally trained physician at the lower extremity. I can write for Lyrica. I can give injections to steroid. I can do the surgery. I can write for Lyrica. I can even spell that one. Because there's a lot of medications that don't do anything for this disease process, but they're FDA approved for pain.
Doc, how do you feel about corticosteroid shots?
Well, I still use them, but they're very damaging. And regenerative medicine, and we'll talk about that in a few minutes, and that's the common denominator to the pathway to reduce inflammation, in my opinion. So steroids, yes, they're used as an anti-inflammatory, but they have a lot of side effects. All the medicine have had a tremendous amount of side effects. Even Advil. Now, the recent literature on Advil is causing chondrodysplasia because it's breaking up the sulfur bonds in your cartilage, the very same medication that you're using to get rid of inflammation. So the common denominator is inflammation. So before we dive into, and it's a big subject, regenerative medicine, we talked briefly before we came on the air, prolotherapy, which is interesting, PRP, which is also interesting, and I've done PRP and prolotherapy for 35 years, but I'm totally all in on stem cell related products.
Absolutely. It's really no longer controversial anymore too, because they take the stem cells right out of like the fatty areas of the person's own body, right?
Exactly. So here's my badge from the meeting, the Perinatal Stem Cell Society. Perinatal. I was thinking, well, why did we call it that? Well, because they're the tissues that come around the birth event from a section. So we have the placenta with the amniotic fluid, we have the chorion, and we have the umbilical cord, we have the hemopoietic tissue inside, and we have Wharton's jelly on the outside. That's the best source of stem cell from a allogenic source, from another person. The ones you just spoke about are from the autologous, from yourself, fat-derived, bone-derived, blood-derived. There are stem cells in just about every tissue in the body, from the tooth, the pulp. But what's the easiest source? Umbilical Wharton's jelly is really the easiest and the most inexpensive source. And it has the most stem cells. And they're immunologically privileged cells. So this is a pathway, though. This is a pathway from understanding the confusion that allopathic medicine has really given us. When you go back to the early 1900s, there were lots of different modalities, homeopathic, chiropractic, allopathic, and somehow we got hijacked by medical treatment on the pharmacologic approach. So lots of money there.
Oh, absolutely.
I'm sure we're not going to make any friends on this broadcast, but in fairness, that's what most doctors were taught. You know, aspirin takes care of inflammation. Of course, this week we just learned that aspirin doesn't help heart disease.
I've had so many people over the last couple of weeks telling me they're taking one daily baby aspirin.
Right, which does nothing but produce money for bear.
Yeah.
So there's no reason to take it. That literature just came out this week. And you don't need to do that. Really what you need to do, let's go back to cause. Cause is inflammation. What's the major cause? Sugar. And which sugar? High fructose corn syrup. So it comes back to diet, exercise, and now stem cells. And lasers, we'll talk about all these adjunctive things we could do to reduce inflammation.
Beautiful.
So let's take a deep dive into stem cells. Now I have a document in front of me.
Advances in adult and non-embryonic stem cell research. And it's hearing?
Yes. Hearing before the Subcommittee of Science, Technology, and Space.
Mm-hmm.
And guess this is the year 2003. So at the perinatal meeting that I was at, I spoke to this gal. Her name is Joanne Kurtzberg. She was one of the people who testified in 2003 on her research, which she had been doing for 15 years prior. This is not new.
Yeah.
What diseases were they looking at? All the genetic diseases, Alzheimer's, autism, spinal cord defects, multiple sclerosis, muscular dystrophy, cerebral palsy. Kids that couldn't walk are walking. Kids who couldn't talk are talking. So I looked up Dr. Kurtzberg's on the Google. I wanted to see what other papers she had written. I found this document. 2003. Who do you think was the person who conducted the hearing? I'm from Arizona. I'll give you a little hint. None other than John McCain.
Wow.
Shocking, isn't it?
Yeah.
That was 16 years ago. Why was this not front page news? I'll ask that as a rhetorical question. Here's the document, it's 60 pages. You look it up on the net. Government document. They're using terms like miraculous, fantastic. We need more research. Of course, that's code for we need more money.
Right.
But it works. So I was at the meeting. The key word there was inflammation. The key products are, let's talk about bone marrow aspirin, because I think most people think of stem cells when it comes to that, and fat derived. Both work, but they're invasive. You have to harvest them. It's a procedure. When you can go to an FDA lab that's licensed, purchase those materials, and the best one, and we'll talk about all of them, they all work, but I think the Wharton's jelly is the best stem cell if you want a real stem cell product. Amniotic fluid doesn't have any stem cells, but tremendous amount of growth factors and anti-inflammatories. The ironic part is John Cook, who I work with at Stanford, is now the world's leading authority on stem cell. He's at Baylor. And he's doing the new thing, or is just still experimental, inducible pluripotent mesenchymal stem cell. Big word. What that means is he can go inside your heart, take your scar tissue from an MI, unravel the genes, and make new myocytes, muscle cells, and inject it back in your heart.
Wow.
This is the new thing. But right now, we can purchase these cells from an embryo, a live birth, from a cesarean section, and inject them for anything. Now, I kind of get flippant with this topic because there's so much controversy. Well, my doctor says I have this, and my doctor says I have that. Well, it's just an interpretation. It's an itis. It's an inflammation. Stem cells, by the way, do not speak English.
Mm-hmm.
A lot of people think they do. They don't know that you have multiple sclerosis. They don't speak French or German, by the way, either. They speak their own molecular language, and it's inflammation. And it's complicated, but your immune system is very well equipped to speak that language. So when you inject stem cell of any type, they're going to go to the area of inflammation and put the fire out. That's really how they work. We can talk about exosomes, immunologic tissue, microvessels, microRNA. That's really the quantum foam of biology.
Right.
It's really just a waveform.
It's going down all the way to the cellular and
microcellular
level and repairing it down there?
You got it, in the paracrine system. So I call it the quantum foam of biology because ultimately, if you keep subdividing these things, it's a waveform.
Mm-hmm.
It's nothing but a communication with another cell that is not in resonance. And I believe, and I just talked to Dr. Reardon, he's the guru from Panama. Have you been following Dr. Reardon's work?
No.
So Dr. Reardon, he would be a good one for you to interview. He left the United States 20 years ago and went to Panama to perfect a lot of these techniques. And he was at the meeting. And I spoke to him, and we were talking about the micro environment of stem cells. And really what they do is three things. Number one, they're powerful anti-inflammatories. Every cell has a marker. There's multiple markers, CD1, 35, 64, and they have maybe 300 to 500 growth factors. Like VEGF is one of the main ones, vascular endothelial growth factor. That's how they work. They match the growth factors with the inflammation. They put the fire out. The word inflammation, it means inflame, flame. That's fire. These are anti-flame, anti-inflammatories. Mm-hmm. So it doesn't matter what you call it. Stem cells don't speak English. I believe from the work I've been doing, they speak a mathematical language, which is Fourier mathematics, which means a simple waveform becomes a complex waveform, which we call interleukin 6, interleukin 16, all these tumor necrosis factors ad nauseam.
The healing factors.
You got it.
Yeah.
It's not that complicated. It's really simple. So we're all in the same business. We're trying to get rid of pain without harming somebody. This is the new thing. So that's why I wrote the book Sugar Crush, is the basis for stem cell. In my new book, which is named at the moment, The Stem Cell Solution, and discussing all these things we just discussed, how you can treat your patients in the new world. I think of allopathic medicine as Sears. When you bought your refrigerator from Sears, that was the 70s. Now you buy your refrigerator digitally from Amazon. I mean, what we did in the 70s is not what we're going to do today or tomorrow.
Doc, I have a question for you. So before people even think about the regenerative medicine part of healing, what is something that they can take into their own hands and into their own health to detox from all this high fructose corn syrup just to get the ball rolling in the right direction?
Terrific question. I have a protocol. I put patients on a ketogenic diet, which means no sugar. Tough to do. They will reduce, and there are a couple of papers have been written recently since I wrote my book, that asymmetric dimethylarginine, which is a good marker of inflammation, which is a much better marker than C-reactive protein to measure your inflammation. So if you lower your ADMA levels, inflammation, your stem cell approach will be much more effective. So how do you do that? Ketogenic diet. But that's not easy to do.
Right.
Because most people are so carbohydrate dependent, and they think just giving up their donuts is going to do it. No, you have to give up bread, pasta, everything we all liked, those Jersey Shore cheesesteaks.
Oh, absolutely, yeah. Pork roll, egg, and cheese, breakfast sandwiches.
Oh, yeah, they taste great. Of course they do. So we got to modify our diet, reduce our inflammation. That's key number one. Now, what I do, because I'm basically keto, I put butter in my coffee is a good way to do it.
Well, yeah.
When I say to patients, they go nuts. What do you mean? That's crazy. No.
Tastes so good too.
Oh God, doesn't it? Are you?
Yeah. Tastes like a milkshake. Yeah. No, I've done keto for like a month or two at a time. I love it. I do it every now and then.
I do it every day. That's my ritual.
Yeah.
I was at another stem cell meeting and we were talking about butter in your coffee. And one of the scientists said, "Do you put an egg in your coffee?" I said, "Really? Try that."
Really? A raw egg?
A raw egg. So put the butter in the bottom of the cup, pour the coffee in, put a raw egg, whisk it, the egg disappears.
You've done it?
Oh, yeah.
Now, what's the benefit of the egg?
Well, it enriches the experience. Now you have the protein, you have the good, all those growth factors in an egg, which is nature's normal food, not the white. You want the whole egg. You want the cholesterol.
Absolutely, yeah.
And we'll get into that cholesterol myth I used to call it. Fraud is really what it is.
Mm-hmm.
So I put the egg in. It doesn't curdle. It's not even there. It's like
it disappears, huh?
Soup. It disappears.
This is very interesting.
I know. It makes your coffee taste or texture is more silky.
Wow.
So then I cooked some bacon. I put it in there. So I had bacon, eggs, and butter for breakfast. It's great. Like rocket fuel. Rocket fuel.
Oh, absolutely, yeah.
do more than one. The first day I did 2 cups of that with 2 eggs and bacon. I don't think I ate for 3 days. I didn't.
Yeah.
It's rocket fuel.
And Doc, do you have an opinion on like intermittent fasting?
I do. I think that's a great thing to do because that induces your own stem cells to whatever you might have left. So let's go through the numbers on stem cell. When you're born, you got millions. You hit age 22, that's your max. You start to slide down to about age 40, you've lost at least 80% of your own stem cells. When you get to 60, it's 90%. When you get to 70, you know them by name. Okay? Harry and George, they have to come to the rescue. You know what you call the disease is when you don't have any stem cell?
Dead. Done.
Dead. You got to have stem cells.
Wow.
So, intermittent fasting, that's how you induce your own stem cells to stress them out of the bone marrow to come back up. So that's a great question. Great question.
And I've also seen a couple cases firsthand of Alzheimer's. If you catch it early enough, it could actually reverse it and their tremors will stop, their memory will come back all through. I'm sure the sugar is directly linked to the Alzheimer's. Do you see any Alzheimer's patients in your practice?
Oh, yeah. 50% of people over 70 have symptoms of Alzheimer's. And it's really, when I wrote the book, Dr. Perlmutter, he wrote Grain Brain and Brain Maker.
Yeah.
I've never met him, actually. He's a brilliant neurologist, and he wants to call Alzheimer's type 3 diabetes because he feels, as I do, it's inflammation. But if it's inflammation of the brain and inflammation of the vagus nerve and every other nerve, we're going to have too many classifications. It's one classification. And I'll tell you the truth, I think it should just be one. Type 1 and type 2, which were differentiated, type 1 diabetes is a genetic disease. Technically, you should be dead if you were born without the gene to produce insulin. But we did produce insulin, so those people are living because of insulin. But a lot of people are being diagnosed as type 1 when they're in their teenage years. I don't agree with that. That's sugar. That's fast food. They're causing their own demise with the inflammation of their pancreas killing their beta cells. So, although I agree with Dr. Perlmutter, I don't want to put type 3, type 4, type 5. No, it's one type, it's sugar, and it's an epigenetic disease, in my opinion. So, epigenetics meaning above the gene pool.
Yeah.
So, I was trying to explain this to a patient the other day. So let's say we had a gene that expresses for multiple sclerosis. Okay, you carry that gene. Yes, that's true. But if you never come in contact with the trigger, you'll never get the disease. I think sugar, and particularly high fructose corn syrup,
turns it on.
So Atlantic City, you're at the crap table. You roll the dice, 7-11 are going to come up statistically exactly over time and with no change. But if you load them, which high fructose corn syrup is a metaphor,
yeah.
and you have a magnet underneath the table, they're going to express that gene more than they should. That's how I look at these diseases epigenetically. And you have to have a trigger. So, and the human genome has to have that. Say there's roughly 7 billion people on the planet. I can guarantee you there's a gene that's going to express for whatever the future holds. If a meteorite hit tomorrow morning and it's just sulfuric acid to breathe, there's going to be enough people on the planet to breathe sulfuric acid, and they're going to take us forward. The rest of us will be dead. That's how it works. Just like bacteria. If you give them penicillin, they'll develop a resistant strain, MRSA, or vancomycin resistant, et cetera, et cetera.
Now, Doc, I have another question for you. So what is your plan of attack with the regenerative medicine and the Alzheimer's? Because it's not like a physical injury.
Yeah, that's a good question. Well, I talk about it in Sugar Crush. First symptom of Alzheimer's is loss of smell, not loss of memory.
Loss of smell.
A lot of people don't know that. So why is that so? Well, the olfactory nerve is the nerve, the cranial nerve, that transmits that sense of the chemoreceptor to your brain in the hippocampus. And there's 3 main processes in the hippocampus. So for some of the people listening, the hippocampus is just Latin for seahorse because it kind of looks like a seahorse. 3 functions. One is a sense of smell, the addiction center, for opioid, sugar, and the rest of it. And number 3, memory. So if the hippocampus is being attacked, in Dr. Perlmutter's book, he talks about that, and it's inflamed. So you can do an MRI, volumetric MRI, and you'll see people with Alzheimer's, pre-Alzheimer's, their hippocampus will be getting smaller in volume. You can measure that. I'll just segue to a political debate. And this I find interesting because, now I forget her name, but the gal who testified against the Supreme Court justice.
I know who you're talking about. I forget her name as well.
Yeah. So she was a neurobiologist, by the way.
Wow.
Yeah. And on her desk in the Senate hearing, she was holding up a bottle of Coca-Cola. Now, that was 9 o'clock in the morning.
Woo.
How many people do you know that drink Coke in the morning?
Only Brazilians.
There you go.
Yeah.
Only addicts, only sugar addicts. She's a sugar addict. And she was testifying on an event from 50 years ago. This is what I say to patients. She should not have had an FBI investigation. She should have had a MRI investigation. You would have seen her hippocampus was shrunken down to look like a prune. So she wasn't fabricating consciously, but she had lost her, I believe she was losing her memory. Those events probably did happen, but not in the sequence she thought. If you're drinking Coca-Cola in the morning, let alone at night, you're an addict. You didn't just pick that up because, you gave up coffee. That's insanity. And that's America.
Yeah. Oh, yeah. Big problem.
So the olfactory nerve, back to the chemistry, it swells. It goes through a very small aperture in your brain, the skull, and it's going to get trapped. First symptom, loss of smell, chemoreceptors. The chemoreceptor in your nose are no different than the mechanical receptors in your feet. So those little fingerprints that we have, put there by the FBI either. Your mechanical receptors. So people listening to this broadcast, run your hand across your desk, run it across your pants, run it across the wall. They're going up and down. They're Merkel and Meissner receptors under those mechanical receptors. When you start to lose those, you lose the sense of touch. When you lose the chemoreceptors, you're losing the sense of smell. If you lose the sense of taste, etc., etc., it's sugar. Oh, I get this. Well, you don't have the proof. Really? I say you haven't read the literature. I have. There's tens of thousands of articles that support what I say. Probably hundreds of thousands. I haven't read all of them. But what I did, this is a sneaky little thing, I went to Dr. Dellon, who's probably written 10,000 of those articles. What's the bottom line? I trained with him. I went to Dr. Cook. He's written 500 articles. What's the bottom line? Michael Hamlin at Harvard. What's the bottom line? What's the bottom line? I didn't have to read every one of those articles, although I read what they told me to read. They're there. I just put the dots together. That's all I did. So it's sugar. It's conclusive. It's nerve compression now. It's conclusive. All these diseases are linked together, and they look like different diseases. They're named differently, but they're very, very similar. Now, obviously, they express differently because the sense of touch, the sense of smell seem to be different, but they're not. It's a nerve compression due to sugar.
Right.
I know it sounds crazy. And then when I tell them to drink hot buttered coffee, so let's circle back to that fraud. Well, doctor, that causes heart disease. Really? And where did you read that? You didn't read it anywhere. You heard it on the TV. Okay, so first question I asked Dr. Cook. He's a cardiologist by training. He's got a PhD in vascular biology. Now he's the presidential fellow for stem cell. He's a bright guy. His first name is John. John, walk me through this cholesterol problem. His words, the lining of the blood vessel, the endothelium, is smooth as Teflon. His word. When sugar irritates that, it becomes like Velcro. Cholesterol is a signaling molecule. It sees that damage, it responds to that damage, and it lays down cholesterol. It does cause narrowing of the arteries, but not because it's primary. It's responding to the accident sugar caused.
Wow.
So this is how I explain it to patients. So we're sitting here and you hear, like behind your window there, you hear a sound, a siren, a signal. And you look outside and you go, damn, there's another accident at the corner. What do you see? An ambulance. Every day you look, you hear, you see, you got to do, you got a little beer there, you got to do this, right?
Yeah.
You go, aha.
Yep.
Cholesterol causes accidents. Ambulances cause accidents. No, they respond to accidents.
Right.
Sugar causes the accident in your blood vessel. Cholesterol responds to
The response to it, yeah.
So a guy named Vercal, 1860s again, because they just started to get photography then, by the way. I think this is why. So they were photographing things so they could communicate. Now we have a cell phone. In those days, it took 20 minutes to develop a photo.
Yeah.
Now I can't stand 2 seconds when it doesn't download fast, which is another subject for another time. But 5G is going to cause a tsunami of problems with nerve.
That's what I've been hearing.
Oh, yeah. So let me just circle back on that because that's the next big thing.
All right.
We should have a separate discussion.
We might have to have a separate episode on that.
Yeah. So Martin Paul, he is a biochemist at Washington State University. So I call him up. I said, I read your book. His book is Unexplained Diseases, all kinds of crazy things you never heard of. But one of the ones I was interested in was fibromyalgia, which is a neuropathy, small fiber neuropathy, C fiber. So Dr. Paul walked me through your biochemistry, and I'm glad I wasn't in your class. He's not the greatest of lecturers, but he's brilliant. I invited him to my seminar in 2011 where I had all these savants at, and they are savants.
Oh, yeah.
And I said, Dr. Paul, walk me through this. He was explaining to me electromagnetic fields back in 2009 when we have, 2G or something like that. Now we have 4G, and we will soon have 5G. That's an electromagnetic field. It's a microwave. And do microwave ovens cause a thermal change? Yes, that's what they're used for. Do they cause a biologic change? Absolutely.
And we have those on our pockets all day long.
You got it. And when you put them up to your ear, you're going to cook your nerves, glioblastoma. So that's another subject.
Jeez.
Sugar plus trauma equals nerve dysfunction. That's my theory. So whether it's gravitational, mechanical that we deal with most of the time, or whether it's the weak force, which is down in the cell itself, the electromagnetic force, or our phones, or the nuclear force. They're the only forces in nature that I know of, unless you can tell me some more. So those forces plus sugar cause nerve dysfunction. It's pretty simple, too, when you think about it.
Yeah, I mean, it makes so much sense.
Yeah. So we're all trying to do the best we can with what we have and the knowledge we have. Your type of approach with a podcast like this is really how to get it out to the public.
That's why we do it, yeah.
Because the public is being deceived. So cholesterol, it's not a myth, it's a fraud. And here's how it went. So Vercal back in the 1860s did an autopsy, opened up the artery and saw that stuff. And I learned when you write a book, you have to read a lot of books. And you'll learn a lot of stuff, more than I'm telling. It's kind of a fascinating process. It's the word atherosclerosis. Greek. Athero means gunk. That's what it means. Sclerosis means hardened gunk in the artery.
Really?
Oh, wow, that's a good scientific word. Oh, it's Greek for gunk. So he looked at it, and he said, oh my God, there's cholesterol in there. So that's where he came up with the cholesterol hypothesis. Then the Russians injected rabbits with cholesterol, and they had cholesterol deposits all over their body. Oh, but they forgot. Rabbits don't eat meat. They're herbivores. That was another misnomer. Then it went on and on. Ansel Keys, 1970s, did the 7-country study and told us cholesterol was causing heart disease, and cholesterol was the culprit. Oh, he forgot to tell us one little minutiae information. It was 22 countries. The other 15 countries, it was sugar. He forgot to mention. And now we have the statin, and you know the rest of the story.
Yeah, they research in their favor.
Absolutely. It's sugar.
Yeah.
Don't take statin drugs. It's craziness.
Unbelievable. So, Doc, usually at the end of every episode, I like to ask my guests, what is one piece of advice that has resonated with you throughout the years that you would like to gift the audience? Could be absolutely anything.
Well, I think that it's so simple, it's sugar.
Mm.
So look at that first. If you're eating a diet high in sugar, carbohydrates, and you're overweight and you have an itis, that's the cause. I know your doctor called it arthritis. I know your doctor called it multiple sclerosis. I know your doctor called it autism, Alzheimer's. No, it's sugar. It's the same disease. It's that simple.
And Doc, where can people find you? Do you have a website? Are you on any social media platforms where people can connect with you?
Yeah, I'm on Facebook. There's a website for Sugar Crush. My practice is called Extremity Health Center. You can contact me through there. Or you go Google. I'm on there on YouTube. The book is in Barnes & Noble, and it's certainly on Amazon.
I'm going to pick up a copy myself. That looks very interesting.
Oh, you'll love it.
Yeah. Actually, I would love to have you on again for that 5G talk, because that's something.
Oh, yeah. Then we'll go into the deep state there.
Perfect. Dr. Jacoby, thank you for coming on. You are a wealth of knowledge in sugar, regenerative medicine. It was an absolute pleasure to have you on. Thank you so much.
Thank you.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.